Hey everyone, this is day 2 of my strabismus surgery, and I just wanted to do another update. As you can see, my eye is still swollen. Let me see if I can zoom in so you can see how red it is. Let's see. I don't know if you can see that or not. Still very red. Very red, very irritated. Let me zoom back out. And it is still swollen, just a little bit. So how am I guess, progressing? Day 2, it's not too bad, but I did quit taking my pain medication. Um, this is what they had me on, and it's oxycodone, and it said to take 1 to 2 tablets by mouth every 6 hours. I took 1 pill yesterday afternoon because I didn't know how it would affect me. And then later that evening I took 2 pills, and I got very, very, very nauseous, and I threw up twice. And then when I went to bed I was still nauseous, and when I woke up this morning I was still nauseous as well. So I ate breakfast, and then I took 1 more pill, and once again I was nauseous. So I haven't taken any more pills since this morning, and I don't think I'm going to be taking any more. The pain is, it's crappy. It really is. But I can control the pain by how I move my eyes. Like if I move my eyes to the left or to the right or up or down, it hurts. So if I want to look left or look right, I close my eyes, turn my head, and then open. Otherwise, your eyes roam just automatically when you turn your head, and it hurts. So that's a way I can control the pain versus, you can't control nausea. You can't, based on how you move, control the nausea. You can't keep from throwing up. And so I'd rather be in a little bit of pain versus nauseous all the time and throwing up. That's just horrible, So yeah, I'm not going to take those anymore. They do also have me taking some eye drops, which are these. And I'm supposed to take 1 drop 3 times a day. And the funny thing is, these are by Bausch & Lomb, which is the same brand that I had bought those blue contact lenses from. I did a review on them about probably last year, I think. And the contacts were horrible. Horrible contacts. So it really surprised me that this was the brand that they purchased these eye drops from. But they do help my eyes, especially in the mornings. In the mornings, my eyes are the most irritated. And when I put one of those drops in my eyes, it's almost like instant relief. It feels pretty good. And I had my husband help me put the drops in because, knowing my luck, I would end up poking myself in the eye or something. In the morning is the worst because when you wake up in the morning, you know how you get sleep in your eyes automatically when you wake up? It's like that, but 10 times worse. All the way across your eyelid, on your eyelashes, and then there's also goop in your eye because your eye is wounded, So it gets goop in there and it gets crusty stuff. I can't even open my eye in the morning. So you have to get that off, and then you have to get the goop out of your eye, and your eye's just irritated. So the mornings are probably the worst time for me. Today's Tuesday, tomorrow's Wednesday. I go back to work on Thursday. So tomorrow's my last day to be home. And I am worried about it because being on the computer or being on my cell phone irritates my eye. And I don't know if it's just the strain. I mean, I know computers can cause strain, but the light also kind of hurts my eyes. So I haven't been on the computer very much. I haven't been on my phone very much. And at work, that's all I do. I sit in a cubicle on my computer. I do data entry for a credit card company. So I'm constantly looking back and forth between credit card applications and my computer screen, typing all day long. So I am worried that it's going to really irritate my eye. And I could have taken the whole week off if I wanted, but you only get 9 days out for vacation a year. So that means you take a week off and then you add in the 2 weekends. That's 9 days. If I did that now for my surgery, I wouldn't get vacation time later in the year. And we had already planned on going somewhere for vacation, and I didn't want to use my vacation time for this surgery. So I will be going back to work on Thursday. And normally, if it was any other job, it wouldn't bother me. But it's just the fact that it's on a computer and my eyes look back and forth between the two. And I can't just move my eyes that easily. I can't do it. So I don't know what I'm going to do. I'll just try my best. As far as the double vision goes, I am still seeing double. Mostly when I don't have my glasses on. When my glasses are on, the double's there, but just barely, you know. And I don't know if I see it more without my glasses because my vision's horrible and my eyes are straining to compensate. Maybe that's causing it. But when my glasses are on, it's fine. And my glasses don't have prisms in them. So, I don't know. We'll just have to wait and see how my eyes heal to see how that goes. But I am very surprised because I had tried these glasses on before the surgery. Double vision was horrible. And it was just so difficult to see. And now with those glasses on, it's like perfect and crystal clear. So don't look at this video and think that the surgery didn't work, because it has. It's just when my glasses are off that my eyes see double for whatever reason. So the surgery has worked, and I'm hoping it's just going to get better with time. And I did have this surgery before. I don't think I mentioned this in my first video. I had this surgery about 5 years ago. And they did it on this inner corner muscle. And what they did is they put a piece of metal into my eye with a string attached. And about 3 or 4 days after the surgery, I went in and they moved the string around while I was awake, but they numbed the eye with some eye drops until I could see clear. And I thought I was seeing clear, but apparently not, because the double vision was still there afterwards. And over the 5 years that progressed, the double vision got worse. And during that time period, I didn't have health insurance, so I couldn't go back to get it fixed until now. Whereas this time, they did it on the outer muscle. They cut the muscle, tightened the muscle, and then sewed it back up. And so that's the difference between the two surgeries that I've had. And would I consider having the surgery a third time if necessary? I would consider it. And I have heard that sometimes it takes 3 or 4 times of having the surgery before the double vision is completely corrected. The only worry would be the amount of scar tissue that I would get in my eye. That would be a worry. But the pain is not that bad. I think it looks worse than it feels. But at the same time, I've had surgery before. When I was 15, I had surgery on both of my Achilles tendons. I was in a wheelchair, I was in braces, I was in casts. I had to use a walker and crutches for a while. And, I had my wisdom teeth out, and then I had the eye surgery before, and now this eye surgery. And my mom has also had a gajillion surgery. She has so many health problems. So it could also be that I'm just used to it. I've had medical problems since the day I was born. I was born premature, and I could just be that I'm used to it. But the pain's not that bad, in my opinion. I've had worse. For sure, I've had worse pain than this. Anyway, so this is day 2. I just wanted to do an update for you guys, let you know how it's healing up and how it feels. I am not taking these anymore. And I'll do another update video in a few days after I go back to work. And then I'll do some more update videos as it heals and let you know how it's going. Anyway, so I will see you guys later, maybe in a few days.